Hi there. My name is Debbie Jerglowitz, and I am the Operations Director at the Community Health Clinic. Today, I will be interviewing Dr. Jamin Yoder. Dr. Yoder is a local physician who practices family medicine and is a member of our board of directors. Dr. Yoder, thank you so much for taking the time to meet with me virtually today.
Thank you for having me, Debbie.
Thank you. Would you mind sharing a little bit about yourself?
I am a family physician that provides full spectrum family medicine, except I do not do any obstetrics anymore. I earned my undergraduate degree from Goshen College and then went on to medical school at the Indiana University School of Medicine, completing my studies there in 2012. I've been here in the LaGrange County area since 2012, and my office is in Shipshewana. I grew up in nearby Middlebury, went to school here in LaGrange County, and I learned Pennsylvania German and English simultaneously. I grew up attending a local Amish Mennonite congregation with my family, and we had a lot of family, friends, and neighbors who were from the Plain community. When I was looking for a work location, I specifically wanted to work in an underserved area of Indiana, and I also had minored in Spanish in undergraduate studies, and so I was hoping to be able to use my Spanish. During my time in medical school, I married my Salvadoran wife and was then privileged to spend time in a small mission clinic in El Salvador during both medical school and residency. And so I was hoping to be able to serve the Latino community too. Initially, I interviewed at the Ligonier office with Parkview and thought I was going to go there. But then Parkview contacted me and let me know that there was an opening and they really needed me in Shipshewana. So that changed the trajectory of my plans. I see all types and ages of patients and particularly enjoy getting to provide multi-generational care. It gives me really good insight into family and cultural dynamics. My wife, 5 daughters, and I have found the LaGrange County area to be a wonderful place to work and live.
Dr. Yoder, there seems to be a common misconception that the Amish are opposed to modern medicine. But the truth is, the religion doesn't restrict the Plain community from seeking modern medical care, and the Amish use local doctors, dentists, and will go to specialists and hospitals as needed. Do you find this to be true of your practice?
Yes, this is certainly true of my patients. They may be more skeptical of modern medicine than some cultures, but most of them do not hesitate to seek help from modern medicine when they need it. They prefer that we work with them when it comes to natural remedies and cultural health practices. But I found that to be true of almost all people.
Hmm. And do you feel the Plain community approaches healthcare differently?
The Plain community places a particularly strong emphasis on value. They're unlikely to want any study or test that is not going to directly impact their care. They will sometimes skimp on quality simply because they see a better price elsewhere, but that may end up costing them more in the long run. Historically, the Plain community has been agrarian and close to the earth. As part of this, some of them do have a preference for herbal remedies and natural medicine whenever possible. The Plain community is a faith community. They very strongly believe in God and eternal life for all those that are faithful to Jesus Christ. As such, they have less fear of death and dying than mainstream America. Typically, they will quietly accept hard things and even death because of their steadfast hope in eternal life.
And in your experience, what type of barriers to healthcare do you see affecting the Plain community in general?
Many of my people are blessed with large families. This sometimes translates into difficulty affording the care that they need. Overall, however, the Plain community really is a very prosperous community, partly at least because of the strong sense of community, especially among the old order community, and the way that they so generously share and practice mutual aid. There are lots of good jobs available in this community, and the other thing that really helps people out is the very low cost of living here. The development of the Plain Church Group ministry has been particularly helpful in making healthcare more affordable and accessible for the plain community. Communication is one area that can be challenging. In particular, the inability to just pick up the phone and reach a patient immediately can sometimes make it necessary to play phone tag. Most patients can readily find a driver, but sometimes it can become challenging if, in caring for patients prior to the one we are seeing, we have gotten behind our schedules and then there's a conflict with their driver's schedule. The plain community sometimes views the medical community with more skepticism than I feel that we deserve. That can be a barrier to accepting and receiving the care that they need. It can be very helpful to have healthcare professionals or staff that understand or are part of the plain community who can then appropriately communicate or translate in culturally acceptable ways that which we would like to communicate to them. Even for healthcare professionals from outside the plain community, much of this happens as they develop relationships with their patients and then provide culturally appropriate care over time in the plain community and earn their trust.
Hmm. And can you share your thoughts on why you think it's beneficial to have a genetics clinic, specifically the community health clinic, found locally in the Plain community?
The community health clinic has been a great blessing to the LaGrange County community. It provides focused specialty care to one of our particularly vulnerable but important populations, our special children. The Plain community has a limited genetic pool due to having a limited number of founders, and as such, we have a lot of genetic disorders. The community health clinic provides culturally appropriate care in an acceptable way to the Michiana Plain community. They save the Plain community an incredible amount of money in travel costs, medical costs, and lost time from work every year. We are blessed to have very talented and dedicated medical professionals, administrators, and staff that are serving our community. While doing this, they are doing research that is in turn helping the entire world as they discover new genetic conditions. As a result, our special children get help that they need promptly and in a way that reduces long-term disability and reduces downstream costs and losses to the community. They provide a tremendous service at an incredible bargain without sacrificing quality.
Dr. Yoder, it is always a pleasure speaking with you. Thank you all for taking the time to learn a little bit more about our local community. If you'd like to learn more about the clinic and the services that we provide, please check out our website. And until next time, have a great day.
Goodbye.